Thank you. Hi everyone. Dr. Saeed, just checking. Are you online? Can we do a quick mic check?
Yeah, I'm online, but my network is fluctuating.
Okay. So shall we begin? Are you okay to begin?
Yes.
Uh, okay. Shreya, can we begin the recording? All right, Dr. Saeed. So then over to you to begin the webinar.
Okay. Good morning, everybody. I want to use this opportunity to welcome us to this.
Dr. Saeed, you are not audible. Dr. Saeed, can you hear us? Okay, it seems some technology issue from Dr. Said's side. Dr. Said, just let us know when you are online. But just on behalf of the Association of Industrial Pharmacists of Nigeria, let me take the liberty to welcome everyone for this webinar, which is on data visibility in supply chain. My name is Sanjay Saha. I am the founder and CEO of BSkill. This webinar is hosted by NAIP in collaboration with BSkill and IAPHL Nigeria chapter. IAPHL is International Association of Public Health Logisticians. So they will also be joining soon, and we will also hear from them. Very quickly, if you are not aware of NAIP, there's a brief introduction of NAIP on the screen. They are the collective voice of registered and licensed pharmacists within Nigeria's pharmaceutical industry. They are also a technical arm of the Pharmaceutical Society of Nigeria. Their focus is to promote best practices in pharmacy education, fostering cutting edge research within the industrial sector, and much more. They organize a lot of professional development events, including conferences, workshops, webinars, and online courses as well. We are also B-Skilled is also partnered with NAIP to organize supply chain online programs in Nigeria, and we will talk about that slightly later in this webinar. Very quickly, let me try to check if Dr. Saeed is back. Dr. Saeed, if you can hear me, it would be great to hear from you before we go to the technical sections of the webinar. Or even if National Chairman, Mr. Onyegbu, if you are available. All right. It seems there's some technology issue over there on that side. Let's move on. Let me introduce today's facilitators. One is, of course, myself, and I would request Oguche to come forward and very quickly introduce himself. Oguche, quick introduction.
Okay, so thank you, Sanjay. My name is Oguche Odo. I would like to introduce myself as a public health supply chain expert because I've worked in the supply chain, especially with regards to the public health sector in Nigeria for a while. I have worked across multiple projects spanning HIV, malaria, maternal and childhood, and I've worked even at the national level, helping to coordinate distribution of public health products by and large to different segments and nooks and crannies of Nigeria. I'm a pharmacist by training. I saw in the introduction one of my professors, Professor Aldo Peters. You're welcome. I'd want to appreciate everyone also for taking time to come for the webinar as well. Over.
Thank you so much, Ogbuche, and a brief introduction of myself. I'm a development professional, particularly working in the space of global public health. I've worked considerably in low and middle income countries, and I've done some projects in Nigeria as well. This is the second time we are organizing a webinar in Nigeria. And of course, we will talk about the supply chain program being organized in the country as well. Just very quickly, Shreya, can you post the YouTube link in the chat? Just to make sure that if anyone is not able to join through Zoom, they can also join the YouTube live, which is the same program happening live on YouTube. So just in case if you face any issues with Zoom, you can just go and watch this entirely on YouTube as well. Very quickly, today we are going to discuss data visibility in supply chain management. We will be talking about some key concepts, and then we will also, Ogbuche will also talk about some specific Nigerian context and examples and challenges. So that's today's webinar. Unfortunately, for this webinar, we won't be able to allow you to speak because we have very limited time and we will have a lot of participants. So if you have any questions, comments, clarifications, we would request you to put them in the chat. The chat box is open. Right now, we would request you to keep writing your small introduction so that we get to know you a bit more. So your name, your location, and your job title. So very quickly, we will begin this webinar. The webinar is recorded, so everyone who has registered for the webinar will, of course, receive the recording as well. So, okay, some sort of, sorry. Yeah, so let me go through the first section of the webinar where we talk about the importance of data visibility, and then I will hand over to Ogbuche for more contextual information as well. So as you see on screen, This is a supply chain framework, a standard supply chain framework, which you can understand for any public health or any program specific supply chain as well. For example, in Nigeria, there are some supply chains which are run federally, while there are some supply chains, most supply chains, I would say, which are run by the state, by the DMA, supported by the LMCUs. Now, if you look at any supply chain, at the very top, you will see some sort of policies and strategies, just like you have your national strategy of supply chain management, you have your national strategy for supply chain professionalization, or even your health system strategies. Now, those strategies guide how your supply chain is governed and how the core functions of supply chain, such as product selection, quantification, forecasting, supply planning, procurement, warehousing, distribution, rational medicine use, quality management, all those things, how they are managed and governed. So those strategies and leadership and governance, that helps in understanding and managing these supply chain functions. However, there are certain supply chain enablers without which these core functions cannot be managed properly, effectively. Now, one of those core functions is data visibility and analytics, apart from others such as financing, workforce, infrastructure, so on and so forth. But today, we are going to discuss one of the key enablers of supply chains, which is data, and how data visibility is really important in supply chain. I mean, if you look at any supply chain, you would understand that without data, without relevant data coming out from supply chains, it is almost impossible to make decisions and manage that supply chain. So let us understand a bit more on the importance of data visibility in supply chains. So as you see on screen, there are about 6 key areas where data helps, rather visibility of data helps. So it helps in creating better forecasts. It helps in managing inventories better. It helps increase the efficiency of overall supply chain processes, whether they are procurement, warehousing, transportation, any of those functions. It helps increase their efficiency. It helps the leaders, administrators, or even your warehouse managers, distribution managers, or even a pharmacist working at a health facility make better decisions. Because if you have right data at hand, which is visible, either on a real-time basis, or say, if not real time, then even if it is deferred, then it's readily available. So if those data sets are available, that various supply chain analysis can be made, and that can lead to better decision making. Then data also helps in improving regulatory compliance. As you can imagine, we are in the public health sector, and supply chain of pharmaceutical products is also governed by a lot of regulation. One of the key regulation is, first of all, registration of products, registration of establishments of manufacturers, wholesalers, distributors. One of the things that these regulators are always looking at is to prevent the falsified or substandard products going into the supply chain, and also reduce any forms of illicit trade. So data coming from supply chain also helps these regulators and the government agencies to manage these issues in the supply chain. And then finally, when all this is properly done in a supply chain, that will eventually lead to better health outcomes and outcomes for patients. Eventually, goal of any health supply chain is to provide better health services to a patient. Because if a patient comes to a health facility and a doctor writes a prescription for certain products, and those products are not available in the facility, then that health services cycle is not complete. So when these products are readily available to be consumed by those patients, that's when they eventually improve the overall health outcomes of a community, of a state, and eventually of the country at large. Okay, so that's how important data and its visibility in supply chain. And all of you, irrespective of where you are working, must have a touch point to data, any kind of data. And we will discuss various kinds of data that should be captured and visible in a supply chain. So there are two slides. First, I will go through what categories of data should be visible in a warehouse. In second, I will talk about what categories of data should be visible in a health facility. So to start with the warehouse, as you can see, first is inventory data. For example, pallet location, SKU, stock keeping unit numbers, description of batches, expiration dates of batches and products. So all this kind of data must be visible when products are kept in a warehouse. Similarly, when products are dispatched from a warehouse, so there is a transportation data. So for example, type of products which are dispatched, tracking numbers or using barcodes, vehicle information, route information, and the status of delivery. For example, whether the products which were dispatched, whether they were delivered or not. Similarly, there are a lot of equipment being used at a warehouse. There should be a visibility on the status of those equipment as well. Then very important is financial data. Um, any pharmaceutical warehouse keeps millions of dollars of inventory. Hence those warehouses must be able to understand what is their expenses, what are their expenses, what is the inventory that they're holding in terms of value, what is their cash flow in terms of how much money that they are spending in getting that product in, and what kind of money that is coming in when they're selling those products to, or distributing those products to health facilities or hospitals. They should also be able to organize something called an activity based costing or activity based accounting. That is very important, because if you don't know your costs in a warehouse or in a supply chain, then it's very difficult to achieve efficiency. Then next is workforce data in terms of your staff, and the efficiency that they bring for the operations. So that is also important. We also need to know the quality data, quality control data. For example, whenever a batch of product arrives in a warehouse, they are kept in quarantine. There has to be some sort of physical verification, visual inspection, and in some cases, samples are sent to labs for quality testing. So those kind of data should also be available. And finally, for any warehouse, safety data should also be available. Safety in terms of safety of staff. That can be clubbed with the workforce data as well. But in this case, very specifically, how is that warehouse kept safe from, say, fire incidents, say from theft, say from pest and rodents, those kind of things. So all this data must be kept, first of all, captured and made visible to the warehouse administrators, whoever is managing a pharmaceutical warehouse. There can be other data sets which are captured and made visible at a warehouse, and they can depend from one warehouse to the other as well, based on some very specific specificity for that location. Moving on, we also need to know what kind of data must be captured and made visible at a health facility. Some data sets are similar to a warehouse as well. For example, inventory data. So for example, data on stock levels, expiration date, location within a small store. But the one important set of data, which is very specific to a health facility, is consumption data. Because here is at a health facility, patients, they are given the products. So we know that what is the actual consumption. In many supply chains, actual consumption data may not always be available because they are either not captured, or they are captured late, or they are captured wrong. And hence many supply chains use distribution data, distribution of products from a warehouse to a health facility, as as a proxy for consumption data, which is not entirely correct. Ideally, decisions should not be made on distribution data. So every health facility must be able to capture and make available consumption data. Again, similarly to the warehouse, they should also capture and make visible distribution data, quality data, workforce data. These are again same as a warehouse, but of course at a much smaller level to a health facility. Another set of data which is very specific to a health facility and should be captured not just as part of your health reporting, but also as part of your supply chain reporting, which is data on patients. Now we're not talking about personal data of patient, but more about patient demographics, key diagnosis, and treatment plans, so that it can match consumption data. Because any prescription that a physician writes to a patient must match the treatment guidelines for that indication, and hence must match the treatment plan, like type of products, the dosage, and everything that is given to that patient must match that, and hence it should be tallied against the consumption. This is called prescription audits, for example. So if you are if any health facility is tracking data on consumption and patients, they should be able to do prescription audits as well. So these were the some sets of data which should be collected and make available at a warehouse and at a health facility. So moving on, I think I will stop here. If you have any questions, please write them in the chat box. We are not going to be able to allow people to speak, because otherwise we won't be able to finish the webinar. So if you have any questions, please put them in the chat. But at this stage, I will invite Ogvuche to take this section forward, and then until the interactive dialogue session. So Ogvuche, over to you.
Okay, so thank you, Sanjay. So in this segment, we'll be looking at electronic logistic management information system, otherwise known as the eLMIS. So basically, the logistic management information system deals with the information flow within the supply chain. So in a supply chain, you have information flow, you have product flow, and then you have finance flow. So the logistic management information system, it can be paper-based or electronic. So in this instance, we'll be looking at the electronic version, right, which captures information, the data that Sanjay just mentioned, information on consumption, information on stock on hand, information on losses and expiries within the system. So basically, the eLMIS offers real-time visibility into the supply chain. It allows for accurate tracking of the movement of products from the manufacturers through the warehouses, and then ultimately to the last mile health facility, as well as to the clients who receive them from the clinics or in the pharmacy. So in recent years, the electronic management information system have been introduced to improve real-time visibility, like I mentioned. So for instance, in the Nigerian public health space, we have what we call the National Health Logistic Management Information System, otherwise known as NHLMIS. So it captures data of the public health products that are the donor-funded products that are distributed across the length and breadth of Nigeria, data on consumption at the health facility level. The facility staff, that the designated facility staff, use the NHLMIS portal to make in their requisition. And in the requisition, what we call the CRIF, they enter their consumption pattern, their consumption for the period, their stock on hand for the period, and that data is used to calculate the orders that needs to be delivered to those health facilities. So in essence, this is a typical case use example of what an eLMIS system does. It is computerized, just as we said, hence the term electronic, and is used to manage health products. It helps to automate data collection, data processing, and then reporting. Because you would agree with me that with an automated system, it's easy to just pull out data for certain categories that you'd want to analyze, and then gives you information, data that you can be used to carry out informed decision making. The eLMIS also provides real-time visibility into the movement and availability of the health product. So this visibility allows health managers to identify stockout, expiries, and overstock situations. So there are situations where a facility might be running out of stock. A manager higher up the chain can just look at all the facilities within the same level and say, okay, if say you can see somebody from Zamfara here, let's say the General Hospital Safi, it's lacking a particular antiretroviral, anti-malaria, and then the manager up there looks and sees that General Hospital Gusau has some that can't be redistributed to the General Hospital in Safi. That can help in alleviating the instances of stockout, because should in case when the product finishes in Safi and is not redistributed from Gusau, you could know that they'll have to wait probably till the replenishment period before the product is delivered to them. So with this visibility inside, it helps to prevent stockout, it helps to prevent wastage as well. So next slide. So what are the benefits of the eLMIS? I mentioned a number of them. It helps to improve supply chain cost effectiveness. Cost effectiveness here will mean when you're able to have increased visibility into the system, it helps to reduce wastages. And by reducing wastages, you are making more judicious use of the available resources that you've used to procure this product. It helps to increase accountability because you are seeing the product flow, you have seen the various stages where the product is passing. And so it helps to eliminate rooms for wastages in the course of the movement of this product along the supply chain. It also helps to improve data quality and decision making. So when this data is pulled out and you're able to analyze it, it helps you to make decision as to forecast, decision as to budgeting and all that. So in essence, the eLMIS helps to improve data quality and decision making. It also provides current and historical data. The data on the consumption pattern, data on the number of patients accessing a particular service within the system, and also it helps to enable to in allocating workload for health staff. So if you see the particular consumption pattern across your health facility, so let's say you have about 20 health facilities in a particular state or in a particular local government. And then from the consumption, you see that the particular health facility has more clients coming to access these facilities. It helps in the redistribution of the health workforce, the supply chain workforce, into the places where they are more needed. And eventually, it also helps. It interfaces with other electronic tools. So I'll go back to the NHLMIS that I talked about. So in the NHLMIS, on the global health system, global health supply chain management program, which is a USAID funded program that deals with the supplies of HIV, malaria, family planning to numerous health facilities across Nigeria. The NHLMS platform interfaces with their ERP called the One Network. So in the interface, there's an API called the Application Protocol Interface that acts as the middleman to help the platform of the NHLMS to communicate with the platform of the 4PL, that's Chemonics in this instance, that handles the distribution of this commodity. And so the good thing about the eLMIS platform is that when you have this various software platform interfacing within themselves, it eliminates the need for laborious human interface, which can be prone to error and all that. So you have these capabilities embedded within the eLMIS as well. Next slide. So there's a saying that says what gets measured gets managed. If you don't have the data, if you don't have the metrics that you're using to track a particular process, you won't be able to manage it accurately. So we're going to be looking at the data that is captured by the electronic management information system. Data elements that needs to be captured include the quantity of products that are dispatched either from the warehouse to the health facilities or dispensed at the health facility level. We have to look at the available stock, that's the stock on hand, and which will give you an indication of how long the products would last within the health facility or the warehouse, as the case may be. You can tell me that's the month of stock. we have to look at the inventory turnover. For those of us in the retail sector, a typical analogy of a high inventory turnover product is products that moves. Let me use our local parlance. So something like a paracetamol that you see when you buy 10 packs today, you discover that within a week or two, it has sold. So those are high inventory turnover product. So you can use that, the eLMIS to capture that as well. The stock requisition, the expiries, the losses, you can also capture it with the eLMIS system, as well as stocks that are immobilized, that's stock that are maybe quarantined that you cannot use again, that have been damaged as a result of maybe a damage generally, stock that have been expired, or maybe when they were shipping into the health facilities, there were issues along the way and the products were damaged. So you quarantine them, so you are not more using them. So those are information, data elements that can be captured by the eLMIS. Over there in the chat and in the slide, you can see the flow from the warehouse to the health facilities, and then ultimately to where the patient receives them. Next slide. So this is more of an interactive segment of the presentation, and I'll be doing it with Sanjay as well. Sanjay.
Yeah, thank you. Thank you, Oguche, for going through the previous section. If anyone has any comments or questions about this section, please ask them. I have been looking at some of the questions on the chat, and I've been trying to respond. The question from Augustine, I could not understand fully, and I think Chris has already okay, there's another question from Chris. So, okay, so we will look at those questions very soon. But this particular section, and let me organize my slides properly. Yeah, so this particular section is an interactive dialogue between me and Oguche. But you can also join into this dialogue through the chat. So as I am asking the questions to Oguche, if you want to answer those questions, you can also write them on the chat. So, Oguche, thanks for taking the slides where we talked about where you talked about how what kind of data must be captured by an eLMIS system. This section, we are trying to understand that once we capture that data set, what kind of decisions can we make using those data sets, and then we also want to understand from where exactly we are collecting that data. So on this slide, we have three different decisions that we need to make. Decision number one is to plan the distribution of products to last mile health facilities. Decision number two is to issue framework agreements, contracts for supply to pharmaceutical suppliers. And decision number three is to purchase trucks, vans, or vehicles for transportation. And these are very practical decisions that any supply chain would make at any given point in time, or as part of their strategies. So what I want to ask from you, Oguche, to start with, and given your experience in Nigeria, that if a state is planning to distribute products to health facilities at the last mile, what kind of data do they need to plan that activity? Over to you.
Okay, so for planning, especially as regards to distribution to the last mile, first off, we want to have information on the location of the health facilities, the location as well as the number of health facilities in the particular state or locality. Okay. Another thing that we'd want to take into consideration is the requisition. That's the orders that have been placed by these health facilities to have an idea of the volume.
Okay.
You would also want to know the stock on hand. By stock on hand, we mean the product that is available for use at that facilities. And by indication, you can also use it to determine how long the stock would last them, like the month of stock.
Mm-hmm.
Mm.
Okay.
Maybe we can check the chat box to see if there are other ideas coming from.
No, not yet. So if you have any ideas in terms of what data needs to be collected to make this decision, please don't hesitate and write them in the chat. I think Ogbuche has a few more, but I guess he's waiting to see if anyone wants to contribute to this dialogue. Maybe Ogbuche, you can keep going. And then if anyone else writes, we will announce them as well.
Okay, so we've looked at the location, we've looked at the order, we've looked at the stock on hand. Vehicle, that's the route planning, can also
Okay.
come in handy, such that
Yeah,
you'll be able
someone said distribution plan. But yeah, someone is saying rate of consumption. So where would you put rate of consumption?
Okay, the
Yeah,
rate of consumption will go with the stock in hand, because normally
Yeah.
for the requisition that is made, it captures both. So based on that,
Yeah.
you'll be able to determine the month of stock. That's how long the last that particular
Yes.
health facility.
Someone has written lead time and then someone has written storage capacity. Are these to be considered, these two types of data?
Storage capacity at the health facilities can come in here, because for some facilities that have maybe little to no storage space, you want to know what can be done, the quantity that you can send.
And lead time? Is it required?
So when you are determining the location and then your route plan, I think that factor is the lead time as well, because you know how long it will take you to carry out the distribution.
Okay. All right. I think this is more or less it. Or is there anything else that is left?
Yeah, for now, maybe while we continue with the other segments, we can also go through to.
Can we quickly put down what could be the sources of this data? So where are we collecting this data from?
Okay, that's the data for the location of the health facilities. That's a normal. You can get it from, so for each state, depending on the context of the state, the Ministry of Health, you can get the number of health facilities that are there. And
I
then
guess
you can
DMA?
also use, yeah?
DMA, State Ministry, State Ministry of Health, correct? Yeah.
And then you can also get it from most times they're available maybe through geographic information system platform. Used to get that as well. For the stock on hand, you'll be looking at the reports from the health facilities. So your eLMIS will come in handy here if you have one in place.
Yep. I think almost we've covered these are their sources, correct? And maybe we need to also take into account the warehouse from where we are going to push the products. Or no?
Not in this instance.
Okay. All right. So someone is also writing State Ministry of Health, DMA, and I don't know what is PHCB. What is PHCB?
Primary Healthcare Board.
Healthcare. Oh, okay. Primary Healthcare Board. Okay, so this is then here itself. PHCB, correct? Excellent. Shall we move to the next point?
Okay, yeah. Go on to the next one.
Yeah, so the next is issuing framework agreements to pharmaceutical suppliers. So the problem statement here is that say a DMA or a LMCU, I don't know who at a state exactly sources products, does procurement, but they have to issue long-term supply agreements to suppliers. So what data do they need?
Okay, for this, they would want to have to know the consumption pattern for the state, or so to say. They want to look at the technical specification for the products.
Sorry? Technical specifications. Okay.
We also
Okay.
want to look at the schedule of delivery. So depending on the volume you're getting from the supplier, you'd want to maybe stagger your delivery to be brought in at specific periods in time. And then you want to look at your budget cycle to know how much you have, when that money will be available for you to place order. So I think I saw the LMCU and National Product Supply Chain Management Program Coordinator mention LMCU. For that first instance, the LMCU, they're like a coordinating mechanism within the states. So information on health facilities, even consumption, because sometimes they aggregate data from the health facilities. LMCU, very veritable source. No, for the first one, the source of the data.
Someone is asking,
Yeah.
sorry, one sec. Someone is asking, should we also add capacity of the warehouse?
Yes, that's when you're not scheduling your supplies. The capacity will come into, because depending on the capacity that you have, will also determine what you would receive at a particular point in time. So the LMCU that I was talking about is for the first question.
Point number first, consumption.
Yeah. No, I mean point number one, the question that we left before we came to the framework.
Sorry, I didn't understand.
So the first question on planning the distribution to last mile.
Yeah. Okay, so here LMCU.
Yes.
Yeah, okay, all right, got it. I think there's a question that you should respond to. Someone is asking, Iobosa is asking, when you talk of source of data, are you referring to the organization or person or the document or platform?
Okay, so the data can come from the source, it can come from the platform. A platform like the eLMIS, but we know that it's an organization or a body, like a coordinating mechanism like the LMCU that manages the platform. So it can be both way, coming from the platform, but the platform, you can't just have access to the platform. Like the NHLMIS, it's not everybody that has access to the platform. So in a state, probably the LMCU coordinator and maybe the data officer there will have access to it. So when you get that information, you go through them to pull out the data for you.
Okay, this is getting very interesting because everyone is now responding. So let's quickly do this because the next one is also very interesting. So shall we quickly do the sources of data? I think it is much simpler.
Yes. So the source of the data here. Yeah, LMCU can come in here as well.
Okay.
The DMA.
The DMA,
where you have this way you have the drug management agency, they can come in because they have the information on consumption. So they were the one that will have the authority that to issue the framework agreement, since they are like the procurement agent. Ministry of Health, in cases where they do procurement.
Okay, someone is asking, are you only talking about public health programs or it includes essential medicines management?
That's why the DMA is coming in here, because the DMA procures essential medicines for the states. It's not just restricted to just public health.
Okay, any other key source like organization from where the data is coming, or this is mostly it?
So somebody mentioned the primary healthcare board. So in instances where you have the primary healthcare development agencies making procurement, they will also need this come in handy here because.
Okay. But is there a, like someone was asking in terms of platform, is there a platform, is there a singular platform available in Nigeria, in the states, where all this data would be, or someone has to go from one organization to the other to collect all this data together?
So for the public health products, the LMCU will be able to coordinate that. But for the essential medicines, so the states where you have the DMA, functional DMA, they should be able to collect information as well.
Okay. So the key stakeholders here are, yeah, sorry, please go on.
No, I say, so it depends on the particular medicine segment you're looking at. If it's for the public health, the LMCU can come in handy. Even the primary development. For the essential
Mm.
medicines, you have the functional DMAs. The DMAs, since they distribute to the facilities across the state, it's a lot easier for those kind of places. But where you don't have a functional DMA, then maybe it's disaggregated. The big
Mm.
facilities like the tertiary health facilities, the general
Mm.
hospitals, their drug revolvement funds will be doing that.
Mm. Mm. Okay, excellent. I think we have understood the gist of what we're trying to say here, is that for any supply chain, whenever you have to make a key decision, you have to look at various data sets that you need to collect to make a rational decision. So, for example, a lot of people are now talking about some platform like mSupply. Someone is saying HMB. I don't know what HMB exactly means, but it seems they have the
Health
data from
management body.
Health
Health management.
Management Board.
So they,
Yeah, so they
yeah, they
have,
control
uh,
the general hospitals in a particular
yes,
state.
yeah. So all this is really, really good data. But unfortunately, we also have to look at the time. So I would like Guche to request if we quickly go to the next exercise and spend some time there so that our participants also understand that, okay, if we have some sort of data at hand, what kind of decisions can we make? Now, it is the reverse of our first exercise where we said that, okay, we have to make certain decisions. So what data do we need? Now we are reversing it. We know what data we have. Now we want to ask what decisions can we make using this data set. Okay, so the first one that Oguche I wanted to ask is that say in a state we have two or three different warehouses. We know the usable storage space available for all those warehouses. So what kind of decisions can we take based on this data? The usable space, net storage or usable space, storage space available in all warehouses, let's say in a state. Over to you.
Okay. So the first thing you want to look at the volume of products that you can store within the warehouses in the state. And with this volume, you would want to use it to determine maybe your maximum, minimum inventory control system.
Okay.
You'd want to use this information also to determine your schedule of delivery with suppliers, with your suppliers.
All right.
Yes, you can use this for inventory turnover rate. So to know how long the product you have would last, so it will help you to schedule deliveries and all that. And then,
Yeah.
and then just replenishment, product replenishment,
So I think replenishment is also linked with the scheduler deliveries, no? Or is it different?
No, the delivery from supplier. Okay, yes, it kind of links.
Okay, so let's also
when it's
replenish. Yeah. Okay, let's see what is. Someone is saying it can be used to determine a supply plan. So I think, yeah, so schedule of deliveries, eventually that will lead to a supply plan, correct? So I will say here supply plan. Is that correct?
Yeah.
Yeah. Okay, excellent. Please keep on writing your points on the chat. We are consistently monitoring it. And if wherever we find an entry which we want to add here, we will announce it. So thanks, Josephine, for adding that last point. Next question, Ogwuche, to you is that we have stock on hand data from various levels. We have it from the central warehouse in a state. We have it from any regional or intermediary warehouses in the state. Then we also have the stock on hand data from the hospitals and the health centers. So what decisions can we take if we have this particular data?
Okay. So for the central, the regional warehouses, you can use that for quantification, that's forecasting and supply planning to determine the quantities of the various health commodities that you'll be needing. You can also use this information to carry out redistribution to health facilities in places where you're having overstock and places where they're running out of supplies, you can use this information to carry out redistribution to those health facilities.
Mm-hmm.
And also use it to schedule deliveries to health facilities.
Yeah. Okay. Someone is saying pre-positioning of stock. I'm not sure what that is, but maybe you understand. Musa is saying pre-positioning of stock.
Okay, so pre-positioning, maybe if you're envisaging that some facilities will have emergency, or maybe in emergency situation, you want to keep some stock handy, should in case supplies from your what do you call it, suppliers have not come. Those pre-positioned products can be used when emergencies arise.
So I'm writing it this way. I think it answers two points. One from Samira, other from Musa. Musa is saying that's right. Someone is saying with some little calculation, you can also know consumption rate. That's correct, but we're asking what decisions can you make? I mean, consumption rate is again a data set. Yeah, so that's not really a decision.
Because with the consumption rates, it fits into your quantification.
Quantification, yes. Yeah, sorry, go on.
Okay. Yeah, that's all from. You can move.
Yeah.
Next.
Okay, excellent. Next, let's do the last one, and then we move back to the didactic approach. The last is we have data of stock issue. So we know what is the stock that is being issued from any intermediary or regional warehouses to hospitals and health centers.
Okay, so the first thing that'll come to mind here is tracking and tracing of the stock along the supply chain, which is very handy when you have product recall or when you're carrying out audits, product audits. Okay. And then, although not ideal, but in case where you have limited data, you can use it as a proxy for consumption.
Proxy for consumption data. Yeah, but please, I hope you have heard Ogwuche. This is not an ideal scenario. Okay, so the ideal scenario is to collect consumption data from the facilities themselves. Yeah. Anything else? Some maybe from distribution. I mean, we know, what kind of fleet planning.
I'm trying to read. Somebody's asking a question. So how do you ensure? Oh, it's gone.
No. How do you ensure quality data from primary source to ensure reliable information from eLMIS? Giving data, there are various challenges to this data source, ranging from limited. I think in summary, what Olu Dio is asking is, how do you ensure quality of data, given sometimes it is not captured properly, sometimes it is captured wrong, sometimes it comes late, so many issues. So I think he's asking about quality of data.
Coincidentally, this is one of the challenges. We'll get into this as well. One of the challenges with data, the quality. So it's not a one-off thing. Capacity building of maybe the logisticians or the health personnel involved in this data, it's there as well. And then putting up some validation protocol in the platform. So it's not a one size fits all. But essentially,
I think you also capture this later in the session,
yes.
right?
Yes.
Yeah. Okay. Someone is saying also build in mechanics to flag data quality. I mean, yeah, the same thing. I mean, I think Oguchi, you're going to talk about this shortly. So maybe let's quickly go there. But in summary, what we were trying to tell you here with these two slides, that supply chain is a very collaborative environment. So whenever you need to take decisions, first of all, you have to collect all the relevant data from wherever possible, just like we are showing you that there are different data sets. Second, you need to collaborate with different people, whether at a health facility or a warehouse, central, regional, intermediary, wherever, to discuss all this, just like Ogvuche and I are doing that, so that you can understand all these issues that you're asking, like data quality, when was it captured, and all those issues. So if you do that in this format, talking to your stakeholders, then your data quality can also improve. Just a very small idea here. But very quickly, Ogvuche, over to you for the next segment, and then we will keep looking at the questions and try to answer them in the chat directly. Over to you, Ogvuche.
Okay, so incidentally, some of these things came up during the discussion. These are common challenges in collecting data across the supply chain. Data quality is a major challenge. So the data can be inaccurate, it can be incomplete or inconsistent, which can lead to incorrect decision making. So that's why it's very essential to ensure that these personnel that carry out or that bring up this data are adequately trained to know what data sets to look out for. You also need to put in place control mechanisms to ensure that the data coming out is of quality data. So that's where DQA, data quality assessment, comes in. From time to time. You can go in to check, to do your audit, maybe triangulating service data with consumption data to see that what is going out is a true reflection of what is happening within the health facility or within the warehouse, as the case may be. Another challenge is data integration. Oftentimes, different segments work in silos. And that's one good thing about the DMA, that's the drug management agencies across the health facilities, or the LMCU in particular, because they help to collate data, coordinate data to ensure that these different silos, everyone doing their own thing, doesn't happen within the state. So integration of data is very, very important. I'll go back to the public health again. Once upon a time, we used to have malaria program doing their thing, HIV program doing their thing. So we had so many duplication, but with the integration of the deliveries of these health products to the various health facilities, and of course with the input from the LMCU that coordinates all these activities, we can see that duplication has been reduced. Integration has led to a lot of cost savings. So data integration is very, very essential. Then data accessibility. Data may not be easily available in a timely manner, making it challenging. So that's why for the last example that we talked about, using distribution data as a proxy for consumption, sometimes you might and then there's time constraint when you're doing your quantification and all that, and you don't have that actual consumption. You are now forced to use those proxy data. So it's essential that data comes in a timely manner so that you'll be able to use it when you need it. Then data security. Data security is very, very important, especially in these days of big data where you have a lot of data breach. So ensuring that sensitive data is secure. Remember when you were talking about in the initial slides when you talk about privacy. So protocols need to be put in place to ensure that this data is not just thrown out into the public for anybody to have access to it. So even in the eLMIS platform that we talked about, there are levels of check. It's not everybody that just have access to it. In a particular state, probably maybe just the LMCU coordinator and 1 or 2 persons. At the national end, maybe the National Product Supply Chain Management Program, and then a few maybe donor implementing partners and all that. So there should be a limit to who can access it, to at least to vouch for some form of security. Then we also see that data standardization is also an issue as well. So there needs to be a standard, a common platform that is used across. Good thing that this just one platform that helps to capture specific data sets, and then manufacturers use that for barcodes, which comes in very handy in tracking and tracing of health products. So the standardization is an issue. The next slide. Another thing again is data governance. So data governance basically talks about a set of rules and processes that an organization have to put in place to ensure that the data that comes out of there is of quality data, it meets international best practices, and then you are not throwing people's private data into the public space and all that. So data governance is very, very essential, and is one key challenge associated with collecting data in supply chain. Data analytics as well. Supply chain data analysis requires skilled experts who are able to churn up this data to analyze them. So it's also good that these experts have certification in analysis. And then as a supply chain personnel, Excel should be your friend. Analytical tools should be your friends because those are things that will help you in carrying out quick analysis of this product. Data visibility, in a number of instances, is fragmented. So when you have a robust eLMIS system that gives you visibility across the chain from the manufacturer or even from in-country receipt down to the health facility, it goes a long way to help. But in many instances, it's fragmented and we don't have full visibility, so it becomes a challenge. And then volume is also very, very, challenging. In these days of big data, you have data churning health facilities. In Nigeria, I'm sure we have over 20,000 health facilities, especially in the public health space. And then you have so many of them churning out data and all that. So big data is a huge challenge. So the amount of data generated by the supply chain can be overwhelming and it can pose as a challenge in a number of times. Then data literacy. It is important that the end users of supply chain that are trained to understand and use it effectively. And that's where it also falls back to data governance. So if you have a robust data governance procedure in place, it helps to ensure that those who are collecting this data are literate enough to know what to collect, to know how to handle the data to avoid all these challenges. Over.
Yeah, Ogwuche, these were very practical points and very specific to the context of Nigeria. Now, as an outsider, I mean, I come from India, and in the health system of India and Nigeria, very similar, in terms of that these two are large countries. There is a federal structure, but then each state is also responsible for the supply chain of essential medicines within the state itself. Now, as I understand, in Nigeria as well, each state are creating their own LMIS systems, sometimes funded by some donors, sometimes by themselves, while the federal government is also trying to create something for the programs, for example, vaccines or some national programs if there are. Now, I know it's a very difficult question, but I just want to put it out there for you to try to answer, is how do you create in Nigeria, how do you create a system where the federal systems talk to the state ones, and similarly vice versa, the state ones talk to the federal ones, so that at a country level, we can see some sort of a dashboard where we can see how different states, at different states, supply chain is working, what are some of the issues that can be addressed collectively. And this is not for, trying to find issues, or trying to find gaps, but just so that every state or the federal system, they work collectively. So do you have any recommendations on how these standardizations across federal and state levels can be done?
Interestingly, we have the National Product Supply Chain Management Program of the Ministry of Health. I can see that Bakura, the coordinator, is aptly present. So they are coordinating mechanism working with the various states, the Logistic Management Coordination Unit, and they have this maturity model where they carry out assessment of the various states to see how the stages they are in the supply chain maturity model. They also sometimes through donor funding and their own efforts carry out capacity building sections for the states in order to beef them up to move along the maturity stages in the model. So they're doing quite a lot. But as you can attest, Nigeria is a large country. We often say that Nigeria is a country of 36 different countries. So I'm presently working in the Caribbean, and a number of countries are smaller than local governments in Nigeria. So you can understand the
Yes,
complexities of
absolutely.
Nigeria. Yeah, something is being done, but a lot still needs to be done. But the good thing is that we have structures in place. We have people that are working their nights to ensure that this integration, this coordination is carried out from the national to the state level.
Let's take one last question and then we move to the next segment. Musa Dauda is asking, can you please elaborate? Sorry, first of all, thank you, Madam Henrietta. She's acknowledged your response. Back to Musa Dauda's question. Can you please elaborate more on data governance?
Okay, so data governance most often has to do with, in fact, okay, like for Musa Dauda, I think Musa Dauda, that name sounds familiar. It's from the Yobe State Drug Management Agency. So an agency like Yobe State Drug Management Agency or Kano State Drug Management Agency needs to have a data governance structure in place, in the sense that it stipulates the processes, what you need to do, the data element, the critical data elements that you need to collect, how you handle that data, who have access to that data because of issues of privacy and all that. So it's a set of, like a policy document that you need to have in place to ensure that your data collection procedure is robust enough so that you don't start collecting inaccurate data that will eventually help lead to maybe poor quantification and its other attendant implications.
Just to add on to Oguche's response, um, data governance is now becoming a very hot topic within donors. A lot of donors are money for organizations like DMA to put in a governance system for data. And this also includes for any system like DMA to understand, first of all, what data needs to be captured, at what level, and who is going to capture it. Because this last question is very important, that who is going to capture it, is because even today, many health facilities or hospitals don't have a dedicated staff to manage data at that particular level. And then what happens is your pharmacist or your nurse or your technician, sometimes even the physicians themselves, they are the ones who are collecting data, which is not ideal because one, that is not their jobs. Second, they don't have any training to collect that data. So if you create a clear governance plan at your state level, then you will understand where those gaps are, and then you can get supported by a donor or a partner in fulfilling that governance plan. And that's why it is very important, and that's why Oguche mentioned it, that this is a key challenge and that has to be addressed. Oguche, is that okay?
Yeah.
Yeah, excellent. So I think this was the last
Yes.
technical slide for this webinar. And I really like to thank Ogbuche for his expert direction on what is happening in Nigeria. Now, the last segment of this webinar, where we are going to introduce and launch our dissemination of the second cohort of the collective learning certificate courses on supply chain for health, jointly organized by the Association of Industrial Pharmacists of Nigeria. Again, I would like to see if Dr. Saeed is back, or if the national chairman is here. But if you're here, please unmute yourselves and you can please speak. But this is a course which is jointly organized by NAIP, Be Skilled, and I'm really happy to announce that for this cohort, we will also be partnered by the IAPHL Nigeria country chapter, and the country lead is here, and you will be able to hear from him very soon. Now, this webinar that we did, this is like a primer of what is there in the program, and the program has more than what we captured in the webinar. So while we discussed some key points on visibility, we discussed some points about importance of data, we discussed how different data sets leads to decisions, and how some decisions need certain data. All this and more is captured in these two courses. This is going to be the second cohort for Nigeria. And this course, there are two courses actually that we are disseminating this time: Collective Learning Certificate 1 and Collective Learning Certificate 2. The first course begins from 24th of June for 6 weeks, and then there will be a small break, and then there will be the second course. As you can see, you get an international CPD certificate. Also, these courses are recognized by the Pharmacy Council of Nigeria. So if you're a pharmacist or a technician registered with the council, you can also ask them to give you MCPD points based on their fee. You can check with them what is the applicable fee today. But you have the opportunity to not only receive an international certificate, but also MCPD points from the council. These are some of the outcomes and modules that we are going to cover in these courses. So right from your health systems, introduction to supply chain, product selection, forecasting, supply planning, procurement, warehousing, inventory management, distribution. And then in the second course, we have foundations like infrastructure, human resources, then data management, like we give you a primer today, quality assurance in supply chain, and performance of supply chain. So maturity models, and understanding the key performance indicators, those kind of things. So these two courses, we are launching the marketing today. But before I show you the next slide, Ogbuche here is a participant from the first cohort, and I would ask Ogbuche to share his thoughts and share his remarks on how his experience was from the first cohort and how this course is very relevant to pharmacists, technicians, health professionals who are working in the area of supply chain.
Okay, so thank you, Sanjay. So one particular interesting thing about this, the particular certification, like unlike the others, you have quite a number of them out there. This is particularly tailored towards specific happenings in the country. So you might want to get a supply chain certification, maybe from somewhere in Europe, that gives you maybe commercial principles, best practice, which are great. But the add-on for this is that it tailors it towards the Nigerian specific context, in the sense that it gives you an idea of what is happening within the country, the product supply chain, and especially for those in the public health sector, it gives you an indication of what is really happening, and then it helps you to appreciate the process more. It gives you more insight on how to better do your job. So that's all I can say was my key learning from this, which it's more of like an unusual way of passing the message with practical applications of what is happening within your specific context. That's Nigeria in this instance. Over.
Thank you. Thank you so much, Ogbuche. And I would also like to say that this is the first course, I would say, globally in this sector, in our sector, where you learn alongside your peers. So I'll give you an idea. In the last cohort, we had 40 participants. They were all, of course, from Nigeria, from different places, different states, from DMA, from LMCUs, from State Ministry of Health, from UN, from Chemonics, and everyone learned together as part of a large family. So we create this peer-to-peer structure, and one of the and we do these surveys as well. And one of the key points that everyone mentioned, that this was the first time we were able to learn like you do in a classroom program. So that is also something where you learn more. You learn from your friends, you learn from your colleagues, you learn from your peers, you learn from people who are working in a different state. You exchange your ideas, you exchange your insights, and that helps you gather more. Now, for this time, we have three facilitators. One is, of course, myself. I will bring the more global insight to it. And then we have two expert national facilitators. And if possible, if Madam Okafor is here, if you can switch on your camera, that will be great. But otherwise, it's also okay. So we have Madam Ukamaka Okafor, former head of PCN in the Lagos state, and she's currently a professor in a university in Nigeria. Then again, we have Mr. Ogbuche Odo, senior expert supply chain. He's currently working in the Caribbean and has extensive experience of working in Nigeria as well, as you saw in the initial slides. So all together, all three of us, we will be facilitating this program. And then we will also invite some other experts from IAPHL, because they are also collaborating with us this time, and other partner organizations to bring more insights from Nigeria, which will help you not only gain the best practices, the global insights, but also more specifically, what is happening in the country, what resources do you need, the templates that you can have that will aid you, in your work. And at the very end, I would like to show you some testimonials from our previous cohorts. As you see, we have from Kwara State Ministry of Health, Bauchi State, We have from Chemonics. We have again, I guess this is repetitive. No. Okay, there are two people from Bauchi State. So as you can see, everyone has given us glowing recommendations. Everyone really loved the course. They really understood, how the course will help them in their workplace, and also, of course, at the same time, they have received their international CPD certification as well. From tomorrow, which is 28th of April, until 22nd of May, we are organizing an early bird discount. So if you see here, the price of one course is about 150,000 Nigerian nairas. So in total, for two courses, if you participate in both, it becomes about 300,000 nairas. But until 22nd of May, there is an offer ongoing where you can enroll in both the courses at 149,999, which is about 150,000 nairas. Okay. More so, you don't need to pay the entire amount today. You can pay 25% of the amount as you register, so that we know that you're going to participate in the course, and then you can pay the balance just before the cohort begins. Okay, and those information will be shared with you. So this is a great opportunity for everyone. You need to pay locally. You don't need to, we have bank account systems working with our partner NAIP. We also have a local payment system called Clasha, which is very safe. You can either pay by your cards or you can pay through bank transfer in Clasha as well. So we have all these provisions for you, where you are able to enroll in this program easily without any issues. There are limited seats, so if you enroll as early as possible, we will be able to guarantee your seat. And then in in June, there will be some more competitions going on, where some people will be able to access these courses for free. So be on the lookout. Even if you have paid for, let's say you have paid an initial installment. If you win those competitions, your whatever you have paid will be refunded. So that's okay. But be on the lookout for those competitions as well. But until 22nd of May, this is the only offer that we have, where you can get access to both the courses at a 50% discount. So without further ado, I would like to, sorry, my colleague is asking me to announce something. So my colleague Shreya has posted B-Skills LinkedIn profile on the chat. We keep on posting more information about these courses on LinkedIn. So please do join us, do follow us on LinkedIn, so that you can get more information on these courses directly on LinkedIn as well. And without further ado, I would like to invite our esteemed colleague, Mr. Chinedu Obi. I believe he's still here. Yes. Chinedu, please, if you can come on screen and share how, first of all, share IAPHL with everyone, and then also share how we are going to collaborate for this cohort. Chinedu.
All right, thanks, Sanjay, and hello, everyone. I don't know if you guys can see me.
We can hear you, but your video is, yeah, we can see you as well. Excellent.
Okay. All right, good afternoon, everyone. And thanks, Sanjay, and Emmanuel, for the presentation on data visibility. Very great points that you have raised there. So just bringing out IAPHL again to everyone. Most of us I know are probably there, but to those who are not very much aware, the International Association of Public Health Logisticians is a platform, dedicated to helping public health, or rather fostering knowledge on public health supply chain among people who are involved in that in this work sphere. It's dedicated to helping them build their knowledge so that they can be able to carry out their work properly. And IAPHL Nigeria is a global, is a global association, and the Nigerian chapter is just a subset of that global association. Of course, it has others in other countries, but in Nigeria, we try to create a forum where we get to discuss supply chain issues, public health supply chain issues in Nigeria. And then, of course, we also look for ways in which we can promote professionalism, helping people to continue to build their knowledge and their capacity when it comes to supply chain management. And that is why it is on this, on this foundation that we figured that the partnership with these skills would be a very good, a step in the right direction. So we are very excited to get on this partnership, and we are looking forward to helping our people, our members, be able to build their skills. I would encourage most of us, to take advantage of this learning opportunity, the CLC courses that are being floated, to also continue to strengthen their knowledge when it comes to supply chain management. So thank you, everyone, and thanks for the opportunity to speak on IAPHL.
Thank you so much, Chinedu, and I really appreciate you coming online and participating in the webinar as well. And this is the first of many that we plan to do with IAPHL, not just in Nigeria, but globally as well. So we are preparing on that as we speak. But at this stage, I would first like to thank our host, the Association of Industrial Pharmacists of Nigeria. Unfortunately, yes, Dr. Saeed, please, if you are able to speak, please, if you can say a few words. We have been missing you since the beginning.
All right. Can you hear me?
Yes, yes, we can hear you.
Yeah, like I said, I'm on YouTube, so my network is coverage. Well, I was able to catch most of the things that was taught today, and I want to congratulate you for a good job. You have done well, and I want to also thank everybody for attending this webinar. One way or the other, I'm sure it must have been impactful to us. So, like the different announcement that has been made concerning upcoming cohort, I want everybody to take the opportunity to attend, plan to attend, and I'm sure you won't regret it. Like you said, last cohort we had.
Okay. I guess today we are not very fortunate to hear more from Dr. Saeed. But I think what Dr. Saeed was trying to say that the success of last cohort was immense. So we want to use that platform to have a great cohort this time as well. More details
Well, let me just conclude by saying on behalf of
yes,
the
please.
chairman, national chairman, Kennedy, FPSF, NAIP national chairman, I want to thank everybody for attending. And we want to look out for other details on the cohort training that will come down. Thank you very much.
Yeah, thank you, Dr. Saeed, and hopefully next time we will be able to hear you much better. But your message is well received. We would like to thank Mr. Ogwuche Odo for his expert, support throughout this webinar. We would also like to thank Chinedu Obi and the IAPHL Nigeria chapter. I'm reading a comment here where it's being said that IAPHL Nigeria isn't as active as it used to be. So I think that is something we need to take into account as well, and possibly this being one of the initiatives we can also work with IAPHL in bringing back that activity more into the country. So thanks everyone for joining us. We would reach out to you with the slides, with the recording, with the Q&A. So we will extract all the questions that has been asked here and on YouTube Live. And we will also send you a full Q&A document coming out of this webinar next week. And then all the information about the courses will also be shared with you over email. Please do take the benefit of the early bird discounts until 22nd of May. Thank you so much. Thank you, Shreya, for organizing this, and thank you, Wilson, for organizing the YouTube Live. We wish you a great weekend, and we will see you again later. Bye-bye.
Thank you, everyone. Bye.